Bueno, pues muy buenas tardes a todos. Muy buenas tardes a todos. Muchas gracias por estar aquí acompañándonos con este primer webinar del año que vamos a tener. Estamos muy felices porque justamente está con nosotros Amy Bucher. Nos va a contar un poquito más de su libro y un poquito más de cómo se puede, ¿no?, una persona introducir a este fascinante mundo de las ciencias del comportamiento, ¿no? Antes de empezar y para ir dando unos minutos también para que la gente nos vaya acompañando, les voy a platicar un poquito más de lo que es el Action Design Network, porque este evento viene dentro del marco del Action Design Network, capítulo Ciudad de México, ¿no? El Action Design Network es prácticamente un grupo de personas que están completamente dedicadas, ¿no?, a trabajar con las ciencias del comportamiento de manera académica o práctica. Eso es lo atractivo de la red, ¿no? Es una red que se encuentra originalmente en Estados Unidos y que poco a poco ha ido migrando hacia afuera de Estados Unidos. Por ejemplo, hay capítulos en Austin, en Boston, en Chicago, la mayoría están en el territorio americano, pero hay algunos otros capítulos que han empezado a salir de Estados Unidos, a empezar a tener justamente estos encuentros, estos eventos en donde tenemos a personas profesionales, ¿no?, como en el caso de Amy, que nos vengan a platicar un poquito más de lo que es trabajar con las ciencias del comportamiento, de todos los beneficios que podemos obtener, ¿no? Por ejemplo, está el capítulo de Melbourne, está el capítulo de México, hay algunos otros capítulos que se van a desplegar justamente por Latinoamérica este año, entonces es muy interesante que estén aquí y los invito, ¿no?, a todos a unirse al capítulo de Ciudad de México. Para este año, ¿no?, además de este webinar con Amy, hay varios eventos, perdón, que tenemos programados, siempre, ¿no?, con la intención de expandir un poquito y divulgar sobre esto, ¿no? El objetivo al final del día del Action Design es dar un espacio a todas estas personas que tienen experiencia con estos temas para que podamos ir expandiendo el conocimiento y, digamos, permeando un poquito esto por nuestros países, ¿no? Si ustedes ahorita están en su casa, tomen su teléfono celular y escaneen este pequeño código QR para que puedan unirse a un pequeño grupo de Meetup que tenemos. En ese grupo de Meetup pues, estamos constantemente, digamos, actualizando sobre los eventos que vamos a tener en el año, para que si les gusta el evento de hoy, puedan acompañarnos en los próximos eventos, ¿no? También, además, el Action Design, digamos, hace varias cosas que ayudan a que toda la comunidad que trabaja con ciencias del comportamiento se desarrolle. Ellos tienen un podcast que les recomendamos mucho, ¿no? Es un podcast que está en inglés, pero es un podcast que tiene acceso también a muchas personas, autores de libros o personas que han tenido ya muchos años, tanto en la academia como en la parte práctica. También pueden encontrar una bolsa de trabajo y pueden encontrar un directorio de equipos que están trabajando, perdónenme, con estas herramientas en México, en Latinoamérica y en otras partes del mundo, ¿no? Entonces, si ustedes quieren saber si pueden unirse donde están, en el país en el que estén, ¿no?, a algún equipo, o si quieren saber con qué equipo pueden trabajar, también ahí pueden encontrar los distintos grupos que han ya trabajado con estas herramientas y que lo hacen, digamos, de manera consistente, ¿no? Entonces, como pueden ver, el Action Design es una fuente al final de información y de conocimiento para, al final del día, buscar e impulsar las ciencias del comportamiento y el uso de las ciencias del comportamiento, ¿no? Para quienes es el primer evento que asisten, ¿no?, para quienes están por primera vez en un evento del Action Design, el año pasado, ¿no?, tuvimos 2 webinars bastante interesantes. Si quieren, también pueden consultarlos, ¿no? Son, digamos, traducciones que se hacen, como el webinar de hoy, ¿no? Una vez que finalice el webinar, nosotros vamos a traducir el webinar para que tenga subtítulos y para que quien quiera releer o rever el webinar con subtítulos lo pueda hacer, ¿no? Pueden ver el webinar que tuvimos con Dr. Stephen Wendell el año pasado y también tuvimos a Robin Kriegelstein, con quienes estuvimos platicando sobre sus experiencias y cómo ellos abordan el uso de las herramientas las herramientas de comportamiento, ¿no? Para hoy, ¿no?, el día de hoy estamos muy felices, estamos muy honrados, ¿no?, de abrirle un espacio justamente a una persona fascinante. Amy Bucher es una persona que tiene mucha experiencia también trabajando en los dos campos, ¿no? Y es alguien que a nosotros nos parece fascinante porque es una persona que habla y escribe mucho desde la parte práctica. Ella es VP de cambio de comportamiento en MatPow y además de eso ha trabajado en empresas como en Johnson & Johnson o en CVS Health, ¿no?, donde se encargó prácticamente de ser la cabeza de aplicación de ciencias del comportamiento, ¿no? Además de eso, ¿no?, Amy es la autora, ¿no?, de este libro que hemos revisado antes en alguno de los, en alguno de los eventos que tenemos, ¿no? Se lo recomendamos muchísimo, es un libro muy bonito para quien está tanto interesado por saber cómo utilizar más potentemente estas herramientas, como para quien quiere ver también cómo es que le puede sacar provecho a las ciencias del comportamiento, ¿no? Entonces, miren, ya sin más preámbulo, vamos a pasarle el control a Amy. Amy, we're very, very honored to have you, and we're very excited to hear you talk. So I'm sending out the controls to you for your talk. Thank you very much.
Thank you so much. I'm just sharing my screen now. Are you able to hear me okay?
Yes.
Okay,
Yes.
Excellent. Thank you so much for having me. I really appreciate the invitation. And I had said to the organizers, I visited Mexico City once a few years ago for work and absolutely loved my time there. So it's a place that I would love to return to. So I'm going to talk today about behavior change design. What is it and how can you get started? How can you become a behavior change designer? And as Emiliano just pointed out, I have written a book called Engage, Designing for Behavior Change. One of the reasons that I wrote this book is that over the years that I have been doing the job that I do, I've had many people reach out to me interested to know, how do you get into this type of career? Behavior change design is still pretty new. I have a PhD in psychology and began working in design teams on the job. But until recently, there really weren't very many academic programs or training programs specifically for this. So the people who were doing it were sort of cobbling together, mixing together skill sets in order to bring psychology and design together. So I was looking for a resource that I could point people to, and I couldn't find one. So I thought, I'll write it. And now we have Engaged. So as I mentioned today, I do want to talk about the process of doing behavior change design. And one of the first, so what does a behavior change designer do? One of the first myths that I often encounter when I tell people about my job is that behavior change designers are able to control people, that because we understand psychology, we're able to predict how people will respond to different stimuli, to different interventions, and basically control them. And I like to just make the point up front that that's not true, that we understand a lot about how people behave and how they think, and we can use that to increase the likelihood that they engage in a particular type of behavior. But we cannot control them. We do not want to control them. And in fact, a large part of my viewpoint is how we can do behavior change ethically so that people are still able to determine their own goals, make their own decisions. And I'll talk a little bit today about some of the psychology of motivation that tells us why that's so important. This is the, I guess, dictionary definition of what behavior change designers do. And I'll point out a few things about the words that I've chosen here. So behavior change designers facilitate the ability of people to work toward goals by designing interventions that address barriers to target behaviors and promote conditions that are favorable to target behaviors. A really important word here is goals, for the reason that I just said, which is that it's very important from an ethical perspective, as well as from an outcomes perspective, an efficacy perspective, that we understand what's important to people and we help them achieve the goals that matter to them. So we really think about what's important to the people that we're designing for. Interventions is the terminology we use to describe anything we build, whether it's a digital product or an experience, and I'll show some examples of what those look like. And then this idea of addressing barriers and promoting conditions, a lot of our work is really about reshaping the environment in which a person engages in a behavior or not, or coaching them to reshape the environment. So we really pay attention to the context in which behavior happens. When I'm telling people about behavior change design, especially because I came from a background as an academically trained psychologist, and now I work in a UX design firm, I like to describe it as living in the overlap of the Venn diagram between UX and behavior science. I do both. The process that we use, and this is the process that we use at my company, MadPow. I have seen versions of this process at other companies, and they have different names, different labels. Sometimes you'll see 5 stages or 6 stages, but generally it's the same process and same set of activities. It's just different decisions about where to draw the line and call something a stage. The one that we use looks like this, and it starts with diagnosis, which is where we really try to understand the problem space. We want to understand what's happening today. And so we will do literature reviews. We will do primary research. Oftentimes the research I do is interviews where I sit down and talk one-on-one with people and really try to understand their experience of a behavior in context. If we're working, because I'm a consultant, I always work with clients, but I've had other jobs where I don't necessarily have a client. If there is a client, I will also research with them at this point. I want to understand their business and the tools they have available and how we might work together in order to make changes to the current state. And I will talk to you a little bit about in a few minutes about a really important part of this diagnosis phase, which is understanding what our goals for the project look like. So not just our users' goals, but our business goals for the project. And the prescribed phase, that's where we really start to figure out the solution. We now understand the problem space. So we're going to think about how can we design a future state that helps people to do something differently. And we will again rely on the published behavior science research for that, as well as our expertise as designers and the research we've conducted ourselves. Once we know what we're going to do, once we've decided on our solution, that's when we implement it. And so for someone like me, where I come from more of a research background, I work very closely with the visual designers and interaction designers at this point to create a product or service, something that actually changes people's behavior. And then, of course, once it's out in the world, we want to know if it works. And so we will measure it. So the evaluation stage is really important. And I've added these arrows because we do test all along the way. You know, I mentioned doing primary research during the diagnosis phase. That's a type of evaluation. We will do usability testing as we have early product prototypes, we will test our assumptions and our solution ideas with users. So all of those types of research are really important and they happen throughout. But then at the very end, once the product is out in the market and people are using it, that's when we have a really big emphasis on measurement in this evaluation phase. So the really important thing for behavior change designers, and the thing that I always tell people when they want to know how I'm different from other types of designers, is that I'm always looking at behaviors. The behaviors come first in the project process. So when I first start working with a client, when I'm first sitting down to think about what are we going to do here, I need to identify the specific behaviors that we will be asking people to do differently as a result of whatever it is that we build. And so I'll just pause for a second here. This is a little quiz. Which ones are behaviors? And I'll tell you the answers, don't worry, but I'm always interested to see what people think. So walking in the park, feeling confident, taking a pill, losing weight, wanting to make a change, being happy, reading one chapter a night, saving $100 a month, preparing for retirement, practicing Spanish vocabulary. If you want to just put in the chat, if there's any that catch your eye that are clearly not a behavior, that might be an interesting way to do it. I'll just wait a second. All right, I'm not going to let that go too long. So these are the answers. The ones here that are behaviors are walking in the park, taking a pill, reading a chapter a night, saving $100 a month, and practicing Spanish vocabulary. And what you'll notice about these things is that they're observable. They're very easy for an outsider to measure. And they're specific as well, which is important. On the other side, the no column here, we have things like feeling confident, wanting to make a change, or being happy. Those are more emotional states, and they are important. We want to consider them because they can facilitate behaviors, but they in and of themselves are not behaviors. Losing weight is an outcome. It happens as a result of behaviors. And then I have preparing for retirement in red because it is just not specific enough the way it's written to be a behavior, but it could be. So a lot of the projects that I work on in the financial services area, we are looking to have people do things like establish a retirement account or to designate a certain amount of money for savings each week or each month. Those are behaviors. And so if I were working with somebody and they wanted to talk about preparing for retirement, my next question would be, what does that mean? Let's get more specific. Once you have your list of target behaviors, and actually I'll just go back here for a second. One of the earliest steps is not just defining the behavior. So let's say we do have a project that's something like we want to help people prepare for retirement. And I ask that question, okay, let's get more specific. What does that mean? Chances are there's going to be a list of answers. There's probably 5, 10, 15 things that people could do to help them prepare for retirement. And like good designers, we want to brainstorm. We want to be expansive and really think about the entire possible solution set. So we will gather together all of those possible behaviors. But then in order to be to make good decisions with our design, to be focused with the thing that we're building, we're going to want to prioritize among those target behaviors and select the few that we really will focus on in our design. And so that's where this next piece comes in, is selecting target behaviors from that list of possible behaviors that we could change. And this is really a practical process. So a lot of these questions are more around the business of designing a product as opposed to a pure behavior science viewpoint. But we do want to, first of all, think about what behaviors will make the biggest difference. So if we have some idea of what success looks like for this project, if we know what outcomes we need to achieve, whether it's we need to sell a certain amount of a product or we need to see people very frequently in my projects, and I think this is a little different in the United States than in other parts of the world, we're looking to have people use emergency services for healthcare less often because that's very expensive. And so that's an outcome that we'll often look at. Can we get people to make a plan to go to the doctor before it's an emergency instead of waiting until they get very sick and then they go to the emergency room? So we would think, okay, if that's a goal, what are the behaviors that are most likely to help with that? We also want to think, again, practically, do we actually have access to the people who do that behavior? Sometimes the solution to a problem happens from outside of our user. And in that case, it might not be the best thing to pick for our project. We want to think about what toolkits we have available to us. An example I talk about a lot is I was working with a company that creates training for construction workers for safety. And we went to work sites and talked to construction workers and understood the various things that led them sometimes to be unsafe. But ultimately, our client built training programs. So that was the tool in our toolkit that we could use. We had lots of ideas for ways that we could change behavior that weren't training, but they just weren't available to us. And then lastly, what is the cost and effort of influencing those behaviors? So typically there's some kind of project budget, project timeline, and we need to make sure that whatever we choose to focus on fits within those. So at the bottom of the screen here, we will literally put together a scoring sheet when we're doing a project. So we come up with that list of possible target behaviors and we decide what are the criteria that we'd like to evaluate them on. Those will always change a little bit depending on the project. But once we know what they are, we'll go and we'll score those behaviors. And the ones that have the highest scores are the ones that we'll choose to include in the product. Not all behaviors are equal. So when we think about behavior change and behavior change design, I think behavior change is part of every single project that happens in UX, but I don't think that every single project requires a dedicated behavior change designer. And so at the bottom of this scale here, thinking about the complexity of the behavior and context, how difficult is it to do? How many factors affect it? And then the complexity of the behavior change approach needed. Some things are they're not that difficult for people to do. They're not something that needs a lot of preparation or thought. And an example might be clicking on a link on a website. It takes a few seconds and usually there's very little consequence. So you really don't usually need a behavior change designer to spend a lot of time figuring out how to get people to do that. But as you follow along, you can see that behaviors become more and more complicated, especially as you get into areas like health, which is where I do a lot of my work. So all the way up to, if you have someone who's just received a diagnosis of diabetes, from not having that, they're going to be asked by their doctor to make all kinds of changes all at the same time. So they'll have to change their diet, they'll have to change their exercise, they'll probably have to measure their blood sugar, they may have to take medication, and so on and so forth. And that is a very complex behavior change problem. So the more complex the behavior you're trying to change, the more complex that context is, the more I would advocate for having a specific behavior change professional involved. At the lower end, it's more likely that somebody who is a strong designer can pick up some of these tactics and understand about human motivation and designing for action in a way that is very, very effective. And I did just want to add that one thing we're seeing over this last year is that coronavirus is an example of something where the behavior change is very complicated. And I know it differs from location to location because one of the factors that really influences it is government regulation and the communication that you're getting from public health officials. But we are really seeing in action how difficult it can be to change behavior when it's so complex and when it's so embedded in people's daily way of living. So just wanted to point out, when I'm talking about complex behavior change, that's an example we're all living right now. So with all this information, what we do is we build an outcomes plan. So Behavior change design is very front heavy. We spend a lot of time early in a project creating plans. And then once we have them in place, we're able to execute on them. I feel like for me as a behavior change designer, my projects are just very labor and time intensive in the beginning. And then as time goes on, they get easier because I've done the hard work of laying out the plan. And now I just have to follow the steps. So one of the first steps is creating this sort of document. I sometimes also call it a logic map. But we actually start at the end here. I mentioned we know what makes our project successful. And again, as a consultant, I probably work with a client to figure this out. They know when they hire me what they're trying to achieve. But when I've worked internal to businesses, we've also had these long-term outcomes that we want to achieve. So we want to get very specific about what those are and then work backwards from there. We are going to put in our target behaviors under behavior changes. What are the behaviors that will help us achieve those long-term outcomes? Even before that, we're building some kind of intervention. We're building something that changes behavior. And in order for that to work, people have to use it. So we want to think about how much do we need people to use it? How do we want them to use it? What do we need to see them doing in our intervention in order to know that they will be changing their behaviors? And then even before that, we want to understand what's happening in the current state, because change isn't meaningful if you can't measure it. We need to be able to say at the end of our project, we've changed something. So we want to collect these baseline measurements. And then the terms at the bottom here, leading to lagging. Leading basically means that's data that we can see pretty quickly. So baseline measurements we can measure right away because that's just how the world is today. And then usually participation and engagement we can measure pretty quickly too, because that's saying as soon as, let's say we build a digital app and we put it out into the App Store, we can see very quickly if people are downloading it, if they're creating accounts, if they're using it. It takes longer to see behavior changes, especially if it's behavior changes that people need to do over time. And then it can sometimes take a very long time to see those long-term outcomes. So I mentioned people using emergency services less. For us to really see that in our data set, it will typically take a year or more. So another thing that this sort of plan does that is very practical but very important is if you're working with a client or you're working with an executive sponsor team, it helps set expectations with them about what you will be able to achieve for them with this type of design. And that's really important, especially because it's a newer field. And there's, there are some approaches to behavior change that can yield very quick outcomes. So one of the reasons that nudge is very popular is because the examples in that book are dramatic. They're very small changes in the environment that lead to pretty large changes in behavior that you can measure almost right away. This approach is not nudge. And so it's important when somebody has read a book like that or has seen that kind of approach and they're excited about it to set expectations so that they don't feel disappointed when you're not doing the same approach. This is an example of what it might look like filled out. And I will tell you, I recently did one of these from scratch for a project, a real project. This is the example from my book. So it's very, very neat, very well designed. But I did one for a real project, and I was reminded how complicated they can be. So I don't want to overpromise that this is extremely easy, but it's extremely worthwhile. So this is an example of what a completed outcome logics map or outcome plan might look like for an intervention for people with high blood pressure, hypertension. And you can see here, the long-term outcomes are really using less emergency services, reducing blood pressure, cholesterol, and weight, having fewer heart attacks and strokes. But then earlier than that, you want to think about behavior changes like going to the doctor, filling your prescription with your medication, taking the medication, getting exercise. How do you get people to do that? Well, you have them register for your app. You see how many times they come use it. If you have educational content, you want to see that they're doing it. If you're asking them to do activities, you want them to be logging that in the digital system. And then even before that, you want to understand what is their current state in terms of blood pressure, cholesterol, and so forth. The other cool thing about these maps is if you notice that something's off track, you're collecting this data from day one. And if you notice that the data is not meeting your expectations, if nobody's registering for the app, or people are registering for the app, but then they're not going to the doctor, that gives you early information that something might need fixing. So if you're working in an agile format, or if you have frequent releases of your product, this is a really helpful way to identify where there might be a need to do something differently sooner, instead of waiting until you don't get the results that you want. So I mentioned behavior change designers build interventions. It's just, a specific term that we use to describe anything that we build. And they're products, experiences, or communications, and they're really designed to change people's behavior in some way. These are some examples of interventions. I collected a lot of these writing my book. I have a Google Photos folder that I think it's well over 1,000 screenshots of all different types of apps and photos and things that I took over the year or so that I was writing the book. But these are some that I really liked. So Nagbot is an intervention. It's a reminder system that you can set up yourself to remind you about anything you want, but it's designed to change whatever behavior you choose. Wobot and Headspace are both in the mental health space. So Wobot is for people who experience anxiety or sadness, and it's a very cool, funny little chatbot. And then Headspace is a meditation and mindfulness app. And then Stash is one that is for people who want to save money, but they are new to investing. They don't understand the stock market or how to invest. And so it's a very simple step-by-step coach that helps you start to put money into the stock market, start to invest your money, and walks you through that. And I will say, I sometimes will say to people that something like Facebook is not an intervention, even though it can have behavior change in it. So Facebook by itself is a platform that delivers, community or allows people to share content themselves, but the platform itself is not an intervention. So just distinguishing the part of the product that is designed to just be a product as opposed to change a specific behavior. So these ones are all intended to change specific behaviors. That was all the prescription phase, or I'm sorry, it wasn't all the prescription phase. That's all the process stuff. Now I'm just going to quickly step through what goes on in the phases of behavior change design. So starting with diagnosis. Literature review, I mentioned, these are screenshots of parts of literature reviews that I've done, but spending a lot of time in the APA database or Google Scholar and really looking at research that's been done in the past on the topic area where you're trying to design. This is something I found really distinguishes behavior change designers from other types of UX professionals. And one of the things that even though I sometimes hate doing a lit review, but one of the things that's really valuable about it is that you can learn from the things that have worked in the past or not. So I think of it as a way to jumpstart success. And it builds a lot of credibility as well in terms of the solution that you build, because you're putting an evidence base underneath your design decisions. So literature review is something that we almost always do in this part of our projects. I mentioned behavior and context, but we really have this understanding that people are not acting in a vacuum. And if you're designing something digital for them, it's really not about what happens on the screen. It's about what happens when they're out in the real world. So we want to understand that. So we will do research ourselves where we talk to people not just about what's going on in their heads, but where are your behaviors taking place? What's going on in the environment around you that's influencing those behaviors? This is the ecological model, and you can see it's from the 70s, but the basic idea still holds that we all live in this context, and we need to understand the context in order to understand behavior. We bring behavior change theories and frameworks into our work, and that means we have to choose which ones we're going to use early in the project. These are some of the ones that exist. So there are a lot. And what I've found happens, I have my personal favorite frameworks that I use because they, the ones that I like to use have a strong evidence base behind them, and they are very relevant for design. So it's like the practical and the kind of purposeful that I really like. But you will sometimes see some of these other models depending on what a project is about. I just made this to show essentially that there are a lot of different models that have an evidence base behind them, and social scientists are actively making a decision about which ones they want to use. When you choose it, you just want to think, is it applicable to this problem area? So some of the ones here you'll see even in the name, we have something like a legal framework that's probably most relevant to something that has a policy or a legal aspect to it. Some of these are very health specific, so you can make an easy choice early on if some of them maybe are not a fit. You want to make sure it has a strong and recent evidence base. So one thing that happens, just like in any field, is that theories will go in and out of style. And so there are some theories that maybe there's nothing wrong with them. Nobody ever did research that said, hey, this isn't valid, but people stopped doing research on it. And so now it's been 10, 15, 20 years without new research. And so typically it makes sense to look for something that's a little bit more recent. And then if you use it, will it actually tell you something useful? So I mentioned before, I have my favorite approaches, and they're in part because they yield something that's very useful for design. And I'll show you what those are. So the first one is self-determination theory. If you've read my book, you know I really love this theory. It's a theory of motivation. I actually organized the book around it. There's two main ideas to it that I'll quickly share. And the first is that whatever motivates you matters a lot. And we need to understand what motivates people from a very personal way in order to get them to do something differently over time. So on the left-hand side of this, you see controlled forms of motivation. These are things like rewards, punishments, expectations from other people. They come from outside of the person, and they can definitely work to change behavior. But if things get difficult to do, if there are obstacles, people are more likely to stop the behavior if this is the only thing they have driving it. Behaviors are longer lasting if people have personally meaningful reasons for doing them. And that's all the stuff on the right-hand side, the autonomous forms of motivation. These are the values that people have. You know, their morals, it's their goals that they have. And these are personal goals. It's not like I want to lose 10 pounds. It's like I want to be a good parent. So those very meaningful goals about the type of person you are. And then, of course, if something is enjoyable, that's intrinsic motivation. So that's sort of the standard that we would love to reach. But oftentimes we're really thinking more about these personal goals, the values, the way people think of themselves. We want to understand that, and we want to be able to draw a connection between the behaviors we're designing for and these things that matter to people. And one of the ways we do it, this is the other piece of self-determination theory that is, you know, if you're doing a 5-minute overview like I am, that you want to make sure people understand, our basic psychological needs. So every human being, this work has been done across cultures, across age groups, across, you know, male, female. We all share these 3 basic psychological needs. So having autonomy, making your own meaningful choices, having competence, learning, growing, and succeeding, and then relatedness, feeling connected to others. So as we design any kind of intervention, we want to think about opportunities to support people in these 3 ways, because as human beings, first of all, we like experiences that support these. So that just makes your product more appealing to people. It engages them. It's where the name of the book, Engaged, came from, is that embedding this into your design makes a more engaging product. But even more importantly, it can help engage them in the behavior you're asking them to do, if you can help them find ways to really support these 3 things. The other model that I use a lot is the cambien model, which you can see here. And I have a couple of chapters where I go in depth on this, but I like this one because it's very practical. You can really design your research using it. So I will write a moderator guide for interviews where I pull these concepts right in. And then on the back end, it makes the analysis of your interview data or whatever type of research you've done easier. So the basic idea behind cambien is that for any behavior, people need to have the capability, the opportunity, and the motivation to perform it. Capability is ability, and that's both physical and psychological. So things like having the knowledge to be able to do that. Opportunity is about the environment that the behavior happens in. So is the physical environment allowing the behavior? And is the social environment, the people around you, are they supporting that behavior? And then motivation, reflective motivation is that, you know, is this a goal for the person? Do they care about it? And is it a high priority? And then automatic motivation is more about the mental models, the belief systems that people have. Is this a behavior that they think is appropriate for them based on the culture they were raised in, or the, you know, what they see going on around them that tells them what makes a successful person or not? So we want to understand these 3 things when we talk about any behavior. And if we can identify where there might be an absence or a barrier, then that tells us what we can design for. So the way that we do that, we've selected those target behaviors. That's an early step. One of the reasons why is because now we can build our research around it. And I ask people to talk to me about their experience of doing these behaviors. This is where we can get that really rich contextual background too. So really learn from people. Tell me about what it's like when you learn the behavior. Who are you with? Where are you? What is the environment like? What do you expect will happen if you do that behavior? And then what makes it harder or easier for you to do? And I'm happy to share the slides over afterwards. These are just some very generic question stems that I use. I change the wording to be more specific to every project that I do, but it will give you an idea of how to start to ask the questions to understand whether there are barriers in these 3 areas. You also can gather evidence at this stage from other parts of an organization. So this is actually a journey map that I worked on with my team at MadPow. And if you work in a design organization, you've probably seen a journey map, but we used COM-B to build this. So as we went through the action steps for the people, and I don't know if you can see on your screens, but there's patients and providers, and then clinical staff like nurses and medical assistants. For each of these people, we identified the behaviors that they had to do in order for the health visit to be successful. And because we used COM-B, we were also able to then say, here are the issues that they're experiencing when they're trying to do these behaviors. Here's how we're going to design to improve outcomes. In order to do this, though, we not only had to do that primary user research with the patients and the providers and the clinical staff, we also had to talk to stakeholders. Those are people at the client organization. We had to understand things like, how do medical supplies get to the clinic? We had to understand how the technology in the clinic works. So the electronic medical record that essentially prompts the physicians as to what they need to do with the patients. How does that work? And then user feedback is something that we didn't do it in this particular project, but if you have a website or a digital app that's already out there, that's another valuable source of uncovering barriers and understanding what might be happening with respect to COM-B. I'm not going to go into great depth here. I mentioned that behavior change designers spend a lot of their time upfront in a project. So those diagnosis and prescription phases are really where we do most of our work. But we do stay involved through prescription and execution. So in prescription, at least for someone like me, where I do not have a visual or interaction design skill set, I'm involved in brainstorming and ideating, but I'm working as a translator. I've come up with a behavior change design plan, and I am now working with the people who can bring it to life to make sure that they understand that and that they can do it with fidelity. I'm also probably testing some prototypes or ideas with users and internal stakeholders, making sure that it's doing what it's supposed to be doing. People like it, they understand it. Making decisions about what to include in the product release. So, working with a product manager or maybe doing some of that myself. And then working with those cross-functional teams to make sure that what we're building actually looks like what we planned. This is an example from Panacea Digital, the screenshot on the right. And I would recommend, if you're interested in behavior change design, that you look at this website. So Marta has done a wonderful job looking at behavior change techniques. That's what BCT here stands for, is behavior change technique. They're basically the things that you can do inside of an intervention to help change behaviors. And she has gone and she's taken all of this terminology and turned it into examples. So concrete examples of what it might look like in a digital app. Basically, the behavior change designer is working with the product team to do just that, to say, based on the problem that I've identified, we need to have a goal setting component of this program. Here's what it needs to look like. So remember these basic psychological needs. I'm going to very quickly show you one of the reasons I love this theory, and it's because there's been so much research done with it. It's about 40 years old. It has a very vibrant research community that is built up around it and is actively doing work. And they have specifically looked at ways that you can build digital products that support basic psychological needs. So I'll just very quickly show you for each. Oh, yeah, there we are. We can support these in our product design. So for the first one, autonomy, letting people make meaningful choices. During onboarding in particular, if you have a digital app, can you give people an opportunity to set their own goals, to basically say why they're there and what they're interested in accomplishing? These are 3 apps that do a great job with that. Pacifica has renamed, and I can't remember the new name right away, but it is also a meditation and mindfulness app. And they ask you when you join, what is your goal? Noom does a wonderful job with this. It's a weight loss app, but they actually have you go through multiple questions to talk about why it is you want to lose weight. And they push you on it. They make you answer it in more and more detail until you get down to something that is pretty meaningful. So it's not just, I want to fit into a dress for the party. It's, I really want to feel healthier and be able to have adventures and live my life. And if you're working with a live coach through Noom, the live coach will actually have a conversation with you about your answers to that question. So they really make sure your goals are part of the experience. And then on the last one here, Purposeful by Kumanu, is an app that they sell to companies for their employees. And it helps people think about what their values are, what type of person do you want to be? And then as they go about their day, it asks them to reflect on, how do the actions that you took today align with your values? So it's really drawing people back to that, what's important to you? What type of person are you? For competence, I love this example. Nobody does this better than video games. but feedback is a mechanism that you can use to support people's sense of competence, because that's really that sense of learning, growing, and succeeding. You want to interact with the world and have an effect. So video games do this really well in general. This is Rock Band. And if you look at the two places with the circles, it gives you two different types of feedback. So this first one down here is with every note that you play on your instrument, it tells you if you were right or wrong. And if you were wrong, you also get information about how wrong so that you can correct your behavior over time. That's really important. When you get feedback, it's not just because you want to know, it's because you want to do better. So that's really great and well done. And then in the upper left-hand corner of the screen, you see your long-term feedback. This tells you how well you're doing over time. How many points have you earned, and are you close to getting a streak? And that's really important too, because we know that behavior change is hard for people, and they will make mistakes and they will have moments of failure. And it's very important to be able to show them their overall progress and help them not feel so bad about the failure right now in order to maintain that behavior change over time. So I love that they do both of these types of feedback in the same screen. And I'm always looking in my projects to see where can I give people feedback that helps them fix their performance right now, but also helps them feel good about everything they've done since their first experience with this intervention. And then lastly, relatedness. People's minds often go to social media, social networking, that can definitely create a sense of relatedness. It can also not. I think we've all seen examples where that can be toxic. But it doesn't have to be a direct connection with other people. So here, this first one, the one that says, great, let's build your team, that's an app called Fabulous. And it gives the person information about why it's important to tell others in their life about their behavior changes and a little bit of guidance on asking for that kind of help or friendship. But they're not actually connected in the app. And the same thing with the one in the middle, that's Super Better, which is, if you have not read the book Super Better by Jane McGonigal, I highly recommend it. It's really fun, but also really good psychology. And again, it just coaches you to ask people in your life to be a partner to you in your behavior change. And then lastly, this one here is Fitbit. And so that one does directly connect people. You can ask people to be in a challenge with you, and you compare your step count to each other. And they have data that shows that when you compete with others or when you have that social networking in the step counter, you do more activity. So this is a specific way that you can bring in that sense of relatedness. And again, one of the reasons that I love self-determination theory for design work is that it does have this clear connection. It gives you a lot of things that you can actually do differently in your design in order to help people get and stay motivated. Just very quickly, that evaluation part, I probably downplayed it a little bit. It's quite important actually, and it is a thing that really differentiates behavior change design from other parts of design, but it's also, it can be complicated, and it really depends on the product, what it should look like. So I just wanted to say that you're going to want to test that your product works. And there's this idea of effectiveness and efficacy. So efficacy is basically, in a vacuum, if you were doing a pure scientific study of this intervention, would it make a difference? And it's really important to evaluate efficacy as best as you can. The gold standard, like the ideal, is to do a randomized control trial. And if you've heard that phrase recently, it's because it's what they do in the medical field when they're launching a new drug or a new vaccination. And we do it as well with behavior change products, but they're expensive, they're time consuming. There's a lot of reasons why you might not be able to do it. And I think there's an argument to be made that it maybe is even more important to look at effectiveness, which is how does this thing work in the real world? Because in a randomized control trial, if you give somebody your intervention to use, you're controlling everything else about their behavior change efforts, right? You really want to isolate whether it's this one thing making the difference. But in the real world, people mix and match. They do things imperfectly. They maybe, use the app 4 times a week instead of 5, or they're using 3 apps at once, and we just don't have a way of knowing. And if that's the way it's going to be used in the real world, it's worth our while to understand if it will make a difference that way too. And so that's where all of these other types of research start to come in. And I'd say it's much more common with behavior change design that you see something like a real world comparison. So we're not actually running a formal study about who gets the product, but let's do a survey of people who do use the product and compare it to a survey of people who don't use the product. Let's see what the difference is. And of course, things like case studies or surveys are really valuable, not just to understand the efficacy of the product, but to do things like sell it, to market it, to get other people interested in using it. So we want to collect this data from kind of a scientific, does it work standpoint, but it also serves double duty in terms of the marketing and the business aspects of a product. Just really quickly, in terms of how do you do this? If you are a designer and you are new to behavior change, I just have 3 quick suggestions for how you can start doing this in your work. Because people have asked, and sometimes they'll say, should I go get a PhD? Should I go back to school? Should I get a degree? And if you want to, that's great, but there is not necessarily a need to spend that type of time to start to do behavior change design. So I would say just start small, try 1 or 2 things. And remember that there are experts, and there are more and more experts with time as this field grows, that you can call on to partner. So the 3 tactics, first is the literature review. And this is something that, most people should be able to do at least a little bit of. Look at the published literature in the topic area where you're doing your project and see what other people have done before. It can be a really helpful way to start to get you thinking like a behavior scientist. And I've listed out here some resources that you could use. It can be difficult to get primary source journal articles if you're not affiliated with a school, because so many of those databases are, pay for service, and they can be quite expensive. But often you can get most of the papers you need through some of these other resources. And I have found that if you reach out directly to somebody who wrote a scientific article, they're usually very happy to get you a copy. They want people to read their work. So that's my best pro tip, is send a tweet or find somebody's email address, tell them you admire what they've done, and ask if you can have a copy. Number 2 is try one of these outcomes maps. So I mentioned I just did one of these from scratch for the first time in quite a while, and it's not totally simple, but it's a good way to really organize your thinking. And again, get you thinking in this behavior science type of way. It helps you define your project goals. It can help you communicate with stakeholders. And, for bonus points, if you've put one of these together, use it, collect the data, see if it tells you anything about how your product is working and if you're able to make iterations more effectively as a result. This is definitely something that anybody can do. And then the last one, and I think the most fun one, is a lensed brainstorm. So most design projects that I've been a part of have brainstorms at some point where you're sitting together with your team. Maybe you've done your research and now it's time to make sense of your findings. And you start thinking, brainstorming. And back before coronavirus, we would literally be in one of our conference rooms. We had them painted with whiteboards, paint, so that we could draw directly on the wall. You can use behavior science frameworks and concepts to guide your brainstorms. So 3 that you can use that I've talked about today. All right, 2 of them I've talked about today. One is those basic psychological needs. So if you're thinking about solutions or features for a product, think about, okay, let's do some that have to do with supporting autonomy or supporting competence or supporting relatedness. You can also do this with cambien. So, all right, what are some ways that we could help enhance capability, opportunity, motivation? And then the 3rd one I put here is the components of habits, because that's another behavior change concept that comes up a lot in design work. And with habits, you can think about cues, behaviors, and rewards. So, what are the environmental factors that are causing this to happen? What are the actual behaviors people are doing? And what is the reward for it? Like, what are they getting out of it? That we could maybe think a little bit differently about. And again, this is a way to just start to bring some of these concepts into your work and see how it influences the way that you're doing it. And like I said, I think this one is pretty fun. So I did include, and I like I said, I'll send over a copy of these slides and you can share them with the folks who've registered, but I have pulled together resources over time of where people can learn more. So conferences and webinars, I have a few specific ideas. And I mean, you're all doing it already as members of the Action Design Network. So that's always a good sign. Podcasts are one of my favorite ways. And I used to enjoy them a little more when I had a commute and I took the train and I had time to listen. But if you're going on a walk, or if you're somebody who likes to listen to things, there are lots of podcasts that have really great information about behavior science applied to design. So these are just a few that I like. And you'll notice not all of them are specific to behavior science, but a lot of them will include behavior science from time to time in these really interesting ways. Social media and newsletters. So just a few that I like, Behavioral Scientist, Habit Weekly. Habit Weekly actually is absolutely wonderful. If I had to recommend one, it would be that. I have books, so I'm not going to leave that up long. And then, of course, my own book, I hope that it is a helpful resource to people. So with that, we have some time for questions.
Thank you very much, Amy. Sorry. Thank you very much, Amy, for this talk. It was amazing to hear you. We're very, very honored to have you here. And we have a couple of questions in the chat, so I'm going to read them to you. The first is from Cesar Calderon, which says, how do you control for context or external variables in your plan?
Yeah, I would say it's less controlling for it and more trying to understand it. So if I had unlimited budget and I had total control over a project, I would choose to do research that combines interviews and observations so that I could not only talk to a person about their context, but actually see it. And that's because people don't always understand their own context clearly. I mentioned I did that project with construction workers, and we were looking at safety behaviors. So we interviewed them, and every single construction worker that we spoke with said that they were safe 100% of the time. And then we spent time on the construction sites, and we saw so many people, nothing big, but lots of small, unsafe behaviors. And I don't think that the people we were interviewing were lying to us. I think that they don't realize, because these behaviors happen so quickly. They're not putting a lot of thought into them. They're not really deliberate. So the more we can understand that context, the more we can design in a way that works with it or helps people to change it. That's the other thing. If there's a way, there's a lot of great work actually in the behavioral economics and nudge area around this. If there's a way that you can create a visual cue for people that tells them that they're doing something wrong, they'll often start to change it. So, I try to build that into my research as much as possible. And if I don't have the ability to go to where a person does the behavior and do the observation myself, I try to ask questions about it. So I've had people describe their homes to me. I've had people send me photos of things that they do. Anything I can do to learn about the context.
Great. And there's a related question to that. Is there a critical point of or amount of questions that should be asked to gather information?
There's no magic number, but I have found when I'm doing research, there's always the point where when I start doing research, I typically feel overwhelmed. There's so much knowledge, so much information, and I'm not sure how I'm going to make sense of it. And as I continue to gather information, it starts to that feeling gets better. And then there comes a point where I'm doing an interview or I'm looking at data and I'm like, oh, okay, I've seen this before. Like it's almost like you know it when you feel it. I've found in my recent projects, probably between 25 and 30 interviews is where I start to feel that. And typically it's less the number of questions and more the duration. We'll typically spend 45 minutes to an hour with each person talking. And but it's that as soon as I get that feeling where I'm like, I know what this person's going to say, or I've seen this pattern before in this study. Like that's when I know that I've gotten close.
Great. There's another question. What do you think of game mechanics to change behavior, for example?
I think game mechanics can be great. I think they are misused a lot. So actually, probably similar to nudges. I think that when people use game mechanics without understanding why they can be effective, that's when we have trouble. And very similar to nudges, when people think that it's like a magic thing that I can implement and it's going to change behavior and they don't think about the context, that's when we have some issues. So game mechanics actually fit very closely with self-determination theory. When they work well, it's typically because they're supporting motivational dynamics. So if you think about something like a leaderboard, which is a really common way for people to use game mechanics in a design, that gets into that sense of relatedness. It helps people see that there are others doing the same activities. It gets into competence because it helps people see their performance relative to others. There are probably ways to design it to support autonomy, but it definitely supports those other two. But you really have to think carefully about whether it makes sense for that particular project and whether it will do those things in that context. So, for example, I have worked on health projects before where they have wanted to do a leaderboard type thing, but it's sort of a sensitive topic. Even think about something like weight loss. The thing with a leaderboard is somebody has to be at the bottom of it. And those are going to be the people who are actually most in need for something like, a weight loss program or a health behavior change program. And so they're going to be demotivated by something like a leaderboard. That's the case where we really want to think about the game mechanics with respect to the psychology behind it. So I think they can be awesome. I'm always wary if somebody asks for game mechanics instead of asking for, I want to achieve this. What's the best way to do it?
Awesome. Now that comes a very specific question. How does this relate to Lean Six Sigma, for example?
I don't think I know enough about, I'm going to back up. The thing that I think is a relationship is doing all of that planning upfront with your outcomes logic map, with understanding what data you're going to collect and what you expect to see in that data helps you to make better decisions about when it's time to make changes to the product. And what I was starting to say is I don't know a lot about Lean Six Sigma. I'm not, certified. I know enough about it to have an idea of what it's about. But I do think that doing the planning up front puts you in a better position to make decisions about quality, to be more economical, to better meet project objectives, things like, finishing on time and coming in at budget.
Okay, thank you very much. There's another question by Santiago Piñan who states that he's been following behavior design for a while, but he did a major in psychology or something related. He did management. So how can he jumpstart his career towards something in behavior science?
Yeah, and I know a lot of very talented behavior change designers who did not get a degree in psychology. So you are not alone, and that isn't a problem. I think things like attending these sorts of events and starting to build a network can be really helpful. To actually get a job doing behavior change design, you probably need to have some sort of demonstrated experience. And so some people will go to a boot camp. I don't know what you all have available to you, but we have things like General Assembly in the US where, you can take a several week or sometimes even just a weekend course, but you actually do some hands-on work and build a project as a result of that. I've had people who've participated. We've actually hired people in the past when we've hosted design challenges, and they've come and they've entered and, spent the 3 days or however long working on a project. But it's a way to demonstrate skills and start to build up that portfolio. So I would say doing those sorts of smaller projects, or if you work in a company where other people are doing this sort of work, asking if you can be a part of those projects. So for me, I didn't really do design work until I was on the job. I was working as a behavior scientist in a company that had designers. I was really interested in what they were doing and got involved with their work. So you could do it the other way. If you have a team of behavior change people in your organization, ask them if you can help out or learn from them. But yeah, ultimately, if you want to actually get a job, I think that's the critical thing, is to be able to point to a couple of projects that you've done that have this skill set in it.
Perfect. I'm going to combine two questions because they're very similar. How do you overcome intervention fatigue? When people get used to the intervention that you designed to change their behavior, what can you do when you face an issue like that?
Yeah, that's a real problem. So I'm of two minds about it. It obviously depends on the specifics. One thing that I think I've got a little bit of a reputation for is I don't think we always have to change behavior forever. So depending on what it is, I'm okay with changing a person's behavior for a while, and maybe they don't continue with the intervention long-term, but we've left them in a better place that they started. But I think the other thing too, one of the reasons I really love working in digital is because it's very scalable and it allows us to do things that hopefully combat that intervention fatigue. So for example, personalization is a way that we can understand how a person is making progress over time. So if we're collecting data that shows what activities somebody is doing or what their performance is, I think that as designers, we should be also creating the experience to evolve with them, to give them different feedback, to set different targets, different goals. Really good recommendation algorithms do this, actually. So something like Pandora, it learns what songs you like, but then every 50th song or so, it throws in a wild card, something that it has no data about. And it does it because it's how it learns. You might hate that song, and then Pandora knows that you hate that type of song. But you might like it, and now you've also experienced something that's different and more engaging. because we like these surprises once in a while. So as designers, I think we need to think about things like that. How do we grow with our users? And then how do we sometimes surprise them or challenge them so that we can, learn more about where they are now?
Great, that's super important.
Mm-hmm.
And I have one last question. Some teams around the world are starting to nudge themselves to have like a certain part of the process or a certain tool that helps them ensure their intervention is ethically based. Do you have something like that inside MATPA, or have you thought about something to make sure your interventions are ethically based?
Yeah, we talk a lot about it at MATPA. We use Slack for our internal communication, and we have a Slack channel that's actually devoted to those types of discussions that's very active. We have a couple of brainstorming tools that we use sometimes. So I will say we don't have we don't use the same exact process for every project because it depends on the people involved. But I think as an organization, we try to do this. And so on my projects, I have a few different toolkits that I have acquired over the years that I will use. So there's a consultancy artifact that has the tarot cards of tech. You can download them for free. And that's excellent. It's basically just thought-provoking questions about, how might this affect a vulnerable user? Or if the worst person in the world were to get control of this, what would they do with it? And it makes you really start to think through those ethical things. And then another one that I have is, I think it's called the Ethical Explorer from the Omidyar Network. And they mailed me a really beautiful little set of cards that was free. But it's a similar sort of idea where they step you through those ethical questions. And so that's something that we'll use especially early on in a project. And then some of it too is I find my training as a behavior scientist is very valuable here because I've had to go through so much training for human subjects research. And often those are the issues that come up. So for example, when we're doing research, I will have clients who will say, oh, we'll just pay people $500 and they'll do whatever we want. And they're right, they will, but that's coercion. That's not ethical. And that's something that I spent a lot of time learning about. And so I'm always, I'm quick to recognize that when it comes up. And I have been trained with the reasoning for why we can't do that.
Great. Well, that's all the questions we have. So thank you very much, Amy. That was a really, really nice talk. I mean, I think it's great that you showed us all this other side that's not specifically focused on nudge. So I think that's a really big part of the area, the topic we're talking about. So that's really nice. Thank you very much for that.
Yeah, you're welcome.
Y muchas gracias a todos los que asistieron, ¿no? A partir de mañana les vamos a estar compartiendo en un correo justamente las slides que nos presentó Amy, y hacia el final de la semana vamos a subir este webinar a YouTube subtitulado. Por si ustedes conocen a alguna persona que pueda volver a escuchar a Amy y quiera verlo con subtítulos, vamos a tener la traducción al español. Y bueno, como les había mencionado antes, estén pendientes a los próximos eventos del Action Design, ¿no? Les digo, este año el objetivo es tener pues charlas justamente con autores, con personas que nos puedan dar esta nueva perspectiva de cómo podemos ver este tema, ¿no? Entonces, muchas gracias a todos. Thank you very much, Amy.
Thank you very much, Amy. It was a huge honor to have you here.
Thank you all. I really enjoyed meeting you all.
Bye.
Goodbye.